HSC option 3, sports medicine. In STEM number 6, we're going to look at what role do the preventive actions play in enhancing the well-being of the athlete. The first area we're going to look at is physical preparation. And physical preparation is essential to enhance the well-being of the athlete. It involves ensuring the body is ready for the activity it is about to undertake. Appropriate physical preparation is a major factor in the prevention of sports injuries. It will also include the development of correct techniques and skills. You will look at the fitness levels of the athlete. You will also look at the warm-up, the stretching and the cool-down procedures. Pre-screening. Pre-screening is an important preventive measure to perform prior to commencing exercise. This is an area that is essential and is usually carried out by completing a questionnaire. Pre-screening provides a starting point for exercise. It also allows exercise programs to be tailored to the individual based on that person's needs and the needs of their sport. Pre-screening also assists in providing the athlete with individualized advice and information. This will minimise the risk of injury occurring. An effective pre-screening questionnaire will consider the person's age, their gender, their health status, and previous experience in physical activity. There are some triggers that would indicate that someone is at high risk, and those would be being over the age of 35 if you're a male, or 45 if you're a female, being overweight, having high blood pressure, having high cholesterol, having diabetes, being a smoker, not engaging exercise for the previous 12 months, or being pregnant. If anyone has any of those conditions, they would be well advised to consult a doctor prior to engaging in exercise. The skill and technique. Many sports injuries occur as a result of poor skill or technique. The injury might be the result of a single direct blow. For example, when a rugby league player puts his head in the wrong position when attempting a tackle, or they may be a repetitive minor impact. An example again being a runner who runs with poor technique. The fact that the poor technique can result in injury places extra responsibilities on the coaches to ensure that players are correctly performing the skills of the game so as to prevent injury before they occur. Correct technique and skill can prevent injury in all sports, but this is especially so in sports that are of a contact or collision sport. For example, rugby league, Australian rules football, boxing, cricket, volleyball, hockey. In all of these cases, if poor skill is used, the athlete is going to be placed at greater degree of risk. Skill may need to be altered according to the weather conditions as well. In wet or slippery conditions, the skill may need to be altered to allow for safer performance of those skills. Physical fitness. Athletes can prevent injuries by placing special emphasis on developing the fitness components specific to their activities. For example, netball players need to work on their speed, their agility, and their hand-eye coordination, as well as their cardiovascular and muscular endurance. These priorities differ from the needs of a marathon runner, who would place a much higher emphasis on developing endurance in their training. All athletes need a certain degree of total body fitness. However, more specific needs of athletes vary from sport to sport and can also vary from position to position in that sport. An example would be a rugby union front row forward would be required to develop their exercises and strengthen their neck, much more so than that of a back whose skills are not required and physical capabilities are not as demanding for that player in that position. Previous injury, a medical condition, a disability, players identified with weaknesses, those are areas that would need to be developed in the training program in developing the physical fitness of the player. The warm-up, stretching, cool down. A warm-up prepares and fine-tunes the body for physical training or competition. It is important that the warm-up focuses on the muscles and movements specific to the activity. A thorough warm-up lasts between 20 and 35 minutes, but it can be shortened or lengthened depending on the climatic conditions. The purpose of a warm-up is to increase blood flow and oxygen to the active muscles, to increase the body and muscle temperature, to stretch ligaments and muscles and to permit greater flexibility and reduce the chance of injury, assist in mental preparation, allow the athlete to commence the activity at their physical and mental peaks. Stretching. A thorough stretching routine should last for about 10 to 15 minutes. Correct stretching exercises will increase the length of the muscle, reduce tension in the muscle, increase blood circulation, and improve a range of motion at the joint. These processes greatly reduce the chance of new injury occurring or old injuries reoccurring. Cool down. After the completion of physical activity, it is important to cool down the body and bring it back to its resting state. During exercise, fluid build up in the working muscles, and the cool down period allows this fluid to be drained from the muscles and redistributed around the body. A proper cool down will reduce muscle soreness and tightness and therefore allow the athlete to recover more quickly. The cool down process should reverse that of the warm-up and mirror that of the warm-up as well. The next area we're going to look at is sports policy. Sports policy will include the rules of the sport, the use of protective gear, safe grounds and the environment. First of these areas are the rules of the sport. When you participate in a sport, players must respect the rules that govern the sport. Players who disregard the rules place themselves and others at unnecessary risk of injury. In rugby league, rules governing tackling outlaw dangerous tackles. These rules are placed there to promote the safety of all players. Players will be penalised for committing offences. In some sports, a yellow card is given, which could signify a sin binning or a time out of the game, or a red card or a send-off can happen if players don't follow the rules. It is the responsibility of the player, the officials and the coaches to ensure that all players play to the spirit of the game. Modification of rules for children. In some games, rules have been modified for children, and this has resulted in the risk of injury being reduced. In some cases, this modification has involved the design of completely new games. Examples of this would be kangaroo cricket, mini basketball, mini and mod rugby league, walla rugby, and minky hockey. The rules have changed in a variety of these sports. An example would be in kangaroo cricket, no fielder is allowed within 10 metres of the batting wicket. In walla rugby, no pushing in scrums and no lifting in lineouts. In addition to the development of these modified games, there are less extensive changes to the rules of adult games that have also been implemented at different age groups. For example, to prevent the overuse injury in fast bowlers in cricket, players under the age of 19 years of age are restricted to the number of successive overs that they are allowed to bowl, and they must be given adequate rest between spells. The matching of opponents in regard to growth and development skill level. The child's readiness for sporting competitions can be measured according to the child's physical capabilities or according to their emotional readiness. Opponents are generally matched according to their age. From the point of view of a sports scientist, however, factors other than age should be considered. Variations in size and strength as well as motor skills should also be taken into account. Children should be matched against other children of similar development, and the purpose is for them to have fun and to improve their skill. If this happens, then they are more likely to continue in sport after the childhood age groups. The use of protective equipment. Prevention is better than cure, and in many injuries can be prevented by the use of protective equipment. Professional sportsmen and women have taken to the use of sports equipment of the protective nature to prolong their ability to play the game. In most cases, the wearing of protective equipment is voluntary. The athlete takes personal responsibility for the use and the prevention. In some sports, though, where children are players, the responsibility of the adults should be to encourage this very strongly. The basic purposes of protective equipment is to absorb and disperse energy from a direct blow, for example mouth guards and helmets, to deflect a blow and protect against sharp instruments, for example a chest guard in fencing, and to limit the excess movement, for example studs in football boots and joint in harnesses and braces. The most common pieces of protective equipment today are those designed to protect the head, the neck, the eyes, the body, the teeth and the feet. And helmets are the example that you would find available in most sports, as well as mouth guards. Safe grounds, equipment and facilities. Grounds and facilities should be designed and maintained to provide a safe playing environment. Safe grounds are characterised by a level and firm playing surface that is free of obstruction. Any likely dangers must be appropriately covered or removed. Likely dangers could include sprinkler heads, broken glass, any fixture that is integral to the game, such as a goal or a post, should be well padded for both training and playing. The training ground and the playing ground should also be secured from spectators and positioned a safe distance from fencing or other obstructions. It should be well lit if required to play or practice at night.